Welcome to Pharmacy in Focus, where I will be having pocket-sized conversations on current topics and interests relating to pharmacy and the wider health sector. My name is Sharina Basan, bringing you Pharmacy in Focus on behalf of the Pharmaceutical Society of New Zealand. Welcome to episode 6 of Pharmacy in Focus. Today, I'm having a conversation with Megan Peters. Megan is a pharmacist with over 20 years' experience in community pharmacy, and more recently has been working in hospital pharmacy and as a primary care pharmacist. Megan is passionate about the role pharmacists have in a patient healthcare journey and the value they can add to healthcare teams as medication experts. She has a special interest in polypharmacy and appropriate medication use in the elderly, including medications in relation to falls. Over her career, she has also been involved in clinical governance roles, has been involved in 2 Whakakotahi Health Quality Safety Commission projects and other local projects aimed at improving patient care. Following the first COVID lockdown in 2020, she made the decision to leave secure community pharmacy work to start her own business to contract clinical pharmacist work and locum services. Megan presents medication education sessions to patients for the Healthy Hearts program, Local Health Foundation, and the Asthma Society Better Breathers patient groups. Welcome, Megan.
Hi, Sharina. Thank you for having me. Sounds impressive when I hear it like that.
It is definitely impressive. Now, you've spent quite a bit of time in community pharmacy. Can you tell me your experiences in community pharmacy and what you enjoyed most about it?
Yes, so I was doing community pharmacy for about 20 years after I graduated in 99. So I've been 1999, that's a long time ago. So I did my internship in Palmerston North in first year there before I went overseas for a few years to Ireland and worked there in a pharmacy in Cork, and did a pharmacist as well as a management role, quite young and fresh out of school, so pharmacy school. So that was, quite challenging. And then I came back and moved to Nelson and did a few years at Price's there in another pharmacy, and then back to Price's for another stint. So I was there about 13 years. While I was there, I did my clinical diploma. And then I took on a role at Victory Pharmacy here in Nelson around some more clinical kind of based patient focused type of projects that they had going there, which was I enjoyed. I enjoy, I suppose, community pharmacy is being with the patient and hoping that you've made an impact in how they look after themselves, and empowering them about their medications and how that actually can impact on themselves and their whānau and family in their healthcare journey, really. That's probably the big thing I enjoy about pharmacy.
Right.
I think I said to you earlier on was when I first graduated, it was the pharmacist was the health professional that everyone saw most often. And that was the catchphrase, and that's what really drew me to it, is that you're having this impact on people's lives, that you really were accessible and able to give them and steer them in the right direction with their healthcare.
Certainly can. And you mentioned the Whakakotahi projects that you're involved in. That was at Victory Square Pharmacy, is that correct?
Yep. Yeah. So the latest one that I did was for D and at Victory Pharmacy, and that was around methadone patients and the impact of their physical health needs that are needed for methadone patients and mental health and addiction patients. Which was a great project. Really enjoyed doing that, and I also got a quality improvement kind of accreditation out of that, which was great. And then the previous one to that was working with some GPs and the diabetes and healthy hearts at the PHO that were doing a project around keeping patients well after a heart event, coming out of hospital after they've had a stent put in. So that was a great project that got to meet a lot of other health professionals. And of course, that's helped me along the way in terms of going on to further projects as well.
Indeed, I did notice that you had said that you're involved in some healthy heart education currently as well. So did that potentially lead on from one of these projects?
Yeah, so that first one with the healthy hearts, and the lady that ran that, B. Williamson, was involved in the project, but she also ran the healthy hearts. So when it became something that was available to do the medications, I've been doing it for probably 3 years now. It's just once a month, patients who recently have had a heart event, stent put in, and just talk about their medications and how that impacts on them. And, and you kind of really get boots on ground kind of ideas around these patients that some of them have never had medications at all before. Wow. It just gives them a forum that they're able to ask questions, and you're able to explain things and why they're on so many different ones, not just, just the one thing for the heart, and how they all work together to be able to help them live better and longer.
Indeed. For anyone who's listening, who's wondering about these projects and how they got started, are you able to give us a little bit of insight?
I mean, I was invited kind of on board from other people that had started the projects. It's one of those things, I think it's who you know, not what you know sometimes. And, that networking is really, really important. Multidisciplinary networking is really, really key, I think. And so that was probably through that, and just being able to know a few people that were coming on board with these projects. And hearts, people with heart events, there's medications involved, and who do we know as a pharmacist who's able to. So I'd say there's a little bit of luck in that. But once you get one sort of project under your belt in that kind of respect, then you kind of you're always in the back of someone's mind in terms of whatever else comes along, and with projects and things. If you think about every disease, usually will have a medication component to it, whether it's diabetes or heart, there's always medications associated with it. And as pharmacists, that's our value. That what we add is around medications. Nurses are great at their job and doctors are great at their job, but as pharmacists, that's our value in terms of we know about the medications and how to communicate those properly with the patients, so that they can, really benefit from them. So I suppose in terms of the projects, it is kind of who you know, and then kind of from that, and you do kind of name gets bandied around a little bit, probably to be popped in for other things. And I think it's just, they say fake it till you make it, but it was face it till you make it in a way, in terms that, just putting yourself out there. And, I knew what I wanted, how I wanted to do it, but I didn't know how to do it. But you've just got to kind of, you don't say no to opportunities. Even if you think you can't, kind of, you're not up to it at the time, you do get there. So for some of the projects, it was, I don't know if I know enough. But then as you go through the project and you learn as you go, because you're learning from everyone. You kind of, you fumble your way through to become, at the end of it, a little bit more knowledgeable than what you did at the start. And then that takes you onto your next kind of phase that you can branch out into and think, oh, that sounds a really interesting thing. I'll just put my name down for it and see how we go. It's that kind of, there was a project I did in community pharmacy, you say about polypharmacy in Falls, and the pharmacy I worked in, we did a lot of rest homes, and, quite passionate around that. And the DHB were putting up a small amount of funding for quality improvement projects. So I just kind of put in a basic business proposal for that, which gave a small amount of money to be able to do a small project that involved some of the rest homes. So it's just having an ear out for those types of things, but also kind of being prepared to, push boundaries a little bit sometimes.
Thank you for that. So you've learned a lot, and you've really enjoyed community pharmacy for around the 20 years that you're working in community pharmacy. You've been involved in quite a few different projects. Met quite a few people along the way by the sounds as well.
Mhm.
What is it that led you from community pharmacy to move into both primary care and hospital?
Oh gosh. It was always this thing that I had in the back of my mind that I wanted to be doing something not for myself, because it's the wrong word, that I could drive and lead and, be a part of. Like I said, I always had I'd done my diploma while I was community pharmacy. And I kind of wasn't utilising that properly in the environment that I was in, and so made the decision to go to the Victory and use my clinical diploma at that point, and was able to utilise it. But I did have that, the polypharmacy and the geriatric side of things was really where I was quite driven, and that was where kind of my passion kind of was. So when COVID hit, it was quite chaotic world. It was perceived to be quite a chaotic world. So it kind of gave me the kind of push to say, it's chaotic anyway. What's the worst that can happen? So again, it's that just taking that leap. There was, if you look at kind of, there was security, but there was an underlying kind of feeling of insecurity as well, as about where everything was going, and it kind of like just forced a little bit of reflection and where I wanted to be and where I was. And I still had 20 years of my career, not giving away my age, but at least 20 years of my career left. What did I want to do and what did I want to achieve? All these things that I had in the back of my head about, how I wanted to impact on patients and things like that. How was I going to best be able to do that? And so that was just the impetus that I needed to do, work clinically, in a more clinical role. The GP practice thing was always kind of, always there. Where I am in Nelson, we don't have pharmacist facilitators in that role. So we don't have clinical pharmacists working in GP practices. So it was kind of this needs to happen. The doctors that I'd met in projects that I've been doing is just like, well, how come this isn't happening? And, why haven't we got this underway? So I kind of just, took a bit of a leap of faith, really, more than anything else. And knowing that, I could work in community as a locum, or if it really turned bottom up, I could easily go back to community work. There was that security there, I suppose, in terms of, but I just had to challenge myself to do it. So it was a case of just, again, who being able to just call a few people and see if there was anything going at the hospital or those types of things. And it was just timing, I think, as well. They needed, someone was coming off the casual roster there, so they needed a casual pharmacist to go on, and that type of thing. So that was the big move. And then doing community locum work. I was able to get some DHB work through our portfolio manager, just around data entry and things like that to help out on that side of things. And also one of the GPs I knew kind of finally went, great, you're not affiliated with anyone. I need you to do something for me, like in terms of a project, which was I wrote a gabapentin audit for the local GP community here, that I could go into GP surgeries and run the audit for them in terms of gabapentin use, off-license use, whether or not, we're doing the proper monitoring and things like that around side effects and that type of thing. So writing that kind of audit. So it was just that kind of, again, just it was busy, and I was busier than what I thought I was going to be. If that's the I honestly thought I'd have to be kind of hanging outside pharmacies asking for work to cover me, but it never kind of ended up like that. So I think the leap of faith sometimes does pay off if you're prepared to pursue it, I think. Yeah.
So taking all of that into consideration, you've talked about how you don't have pharmacist facilitators working in GP practices in Nelson. Do you have a specific role in a medical practice there now, or is it more small contract work such as the gabapentin audit that you just mentioned?
Yeah, no, I'm a contractor to the particular medical centre. Again, it was who you know. And working with one of the GPs had been on the Whakakotahi project with me, the cardiac one. And again, realising that I wasn't affiliated with any particular pharmacy and was independent, that they were having some troubles with GPs, getting enough GPs, the workload that they had involved, and wanted to trial whether or not having a clinical pharmacist within the practice would be helpful. So we did a little bit of a small trial for a few weeks and having me in there. And by, I think, the end of the first morning tea, they were saying, we've just got to have this. It's, so I knew it was going to be something that they're going to keep. And they do that and they fund that independently. So wrote a business case and was able to get that. And they do that, and I'm charged. I see patients, I do their medication reviews, their annual medication reviews, or their complex medication reviews. I do quite a few of their diabetes patients, learnt the diabetic annual reviews to help the nurses out, remove their workload a little bit. So so I am utilised, clinically within the practice. And I have had other practices approach me as well.
Right.
To do that as well. But then, our second wave of COVID's kind of hit. So we'll just put that on the back burner until everyone's kind of a little bit more robust in their workloads.
Wow, sounds like it's been, as you say, busier than what you thought it was going to be, but now you're also being called on by other medical practices as well. So that must be quite comforting for you to know that you've taken this leap of faith, but actually it's, it has its rewards.
Yeah, and it is kind of what is needed. And I mean, even if it spurs Nelson to get facilitators on board, I think that's a great thing as well. Give others opportunities to be able to do that. It's so the GP practice is 2 days a week, and that's regular, and I'm in there, and I have I'll roll on in there tomorrow morning, and I'll see whether I have 8 patients for the day, or or whether or not I'm going to be helping them out doing repeat prescriptions, or it's I'm not idle. Is the best thing. And then the hospital work, of course, is on top of that, and that's a casual role in terms of when they need me for things like holidays, but it has turned out to be more of a regular casual position. So and that's been great clinically, challenging coming straight out of community into that hospital environment, but great. I work with great people, wherever, whether it's been in community or whether it's in hospital, or even within the GP practice and the GPs and the nurses, they're all really, really good people, and they know so much, and we're always learning. We're never experts really. So that's probably the key thing with the hospital, is that it was very foreign for me, and I did find it quite challenging to start with, but the staff that are there and my colleagues are just incredibly supportive. So we got through those first few speed bumps.
That's great. I guess with anything new, it can be quite daunting, right? So to have supportive colleagues around you to help through that is it's always going to be of benefit.
I think, that's probably with anything. If you've got good people and good supports and things like that with whatever you want to try and do, then you'll be successful. So Well, you'll get through. You'll get through. Yeah.
Now, recognising you were in community pharmacy for quite some time, you're now in primary care as well as doing some hours in the hospital.
Mm.
Have you found your relationships with other health professionals been different between when you're in community pharmacy versus medical practice or hospital environment?
Yeah, I have noticed. Yeah, I mean, not that. I mean, there are pressures on every sector. I mean, we don't do multidisciplinary, I don't think, very well sometimes, and we all work in our silos quite independently, and nobody understands the how hospital works versus how, you know, working community pharmacy. And I think that's probably been a big eye opener for me as well, as things that you consider would be a barrier or not a barrier, or why hasn't that been kind of followed up or done, or how would you would approach that. You see the other side of things. You're able to understand that, oh, that actually isn't a possibility for them to be able to do that with their workloads, or so I think for me, the hospital, the biggest eye opener for me was in that clinical environment in the hospital, where when you're on the wards, you're quite a big part of the patient care in terms of, you know, the charts, and you're quite often asked for, advice around types of the medications and the dosing and those types of things. We're in community, we're just there with a piece of paper that's been thought, you know, and we're at the end of it. And if we are ringing a doctor, sometimes that is quite challenging for a doctor, for us to ask about whether the dose is what they intended to be using. Quite a few times over the years, I've had some conversations with GPs where they're quite adamant that Augmentin should be given 4 times a day, and that's how they just want it to be. And it's, and dispense is written kind of thing. And whereas I think in a hospital environment, quite often you do have the backup in terms of you're there clinically, you're part of the decision making. So your I suppose your expertise is valued a little bit more. GP practice I work for is amazing anyway. So, they're a great bunch of nurses and a great bunch of doctors. So they've been very accommodating, and I haven't really seen too much of a problem with, or anyone kind of worried about me overstepping boundaries, or encroaching on nurses' work or anything like that. So so the relationships in that respect have been quite good. But I am aware of other places where that's not such a easy kind of ride. But yes, I suppose I'm lucky in that respect. But yeah, that would be, as I think I said at the start, the value that we add as pharmacists is our knowledge around medicines. And I think that's probably a little bit more valued in that hospital clinical situation than what it would be in community pharmacy, and we're just double checking on a prescription to the doctor. It's some doctors are good at it, some doctors aren't so good at it. So
sometimes it's a relationship you have with them as well, because it sounds like you have a good relationship with some of the doctors that you're working with anyway. And so if you're in, regardless of where you are or where you're working, they know you, and they trust and value your knowledge.
And I think it's it is that seeing the other side of things, the challenges that GP practices have on an everyday basis, that because we work in such silos, we don't understand that, the pressures that are other. I remember that when the electronic prescribing comes in, I was involved with the DHB in trying to kind of smooth over relationships between practices and pharmacies, because there was a lot of they're doing this and they should be doing this, and they're not doing it right, and why can't they do it that way? So going in and being able to kind of make that understanding between, well, you do realize that, in a pharmacy that has to be printed out at the other end, and then it's, why hasn't it been done? It's electronic. Shouldn't it just be, well, no, it's not. It has to be printed out at that end, and still in the same same processes once it gets to the pharmacy, and they're going, oh, I didn't understand that, I thought it was just an automatic kind of, they dispensed off the screen, or that, so there's that, without understanding how everybody works. I think we're always bound to probably put blame where it shouldn't be put, or so it's an understanding of how everyone works is been probably a really good eye-opener for me as well, and then I can explain that to people as well. It's not just they're having a bad day as well. There's the challenges of COVID for everyone, I think, in healthcare. It's been substantial, so we're not living in a if this was it's different than what it was a couple of years ago anyway. We're just
that's right. And I guess even not being co-located in general, whereas if you're working in a medical practice, if you're working in a hospital, you're seeing your nursing and other GP colleagues every day, walking up and down the corridor, so you can have certain conversations, whereas maybe in community pharmacy, medical practices, there is that physical difference in location. So you don't actually see what people are doing on a day-to-day basis in the same way.
Yeah, and you don't, you're not at the end of the conversation around the dosing of the medication saying, oh, and by the way, how was your weekend? You don't have that kind of collegiality, whereas in the GP environment or that hospital environment, you just have that little bit more time to be able to just say, oh, or overhear a conversation and participate, or it's just a little bit different.
That's right. Now, Megan, what are some of the challenges that you have faced in your career?
Oh gosh, I think there's challenges in anything, and it's just how you face them sometimes, in terms of challenges being there's always busy workloads, or trying to fit in a lot of things, or I think challenge being working almost full time as well as doing your postgraduate work, or I don't see things as probably that kind of, maybe sometimes when they're happening to you, you kind of think it's overwhelming. I don't think they're real challenges. There's overwhelming times where the workloads feel so big, or and that's probably what I'd perceive as challenges. But when you look back and reflect on it, sometimes it's just that you didn't have the right supports in place, or you did take on too much, and you really needed to say no to a couple of things, or so challenges, career-wise, I think I've actually been pretty blessed. It goes back to that support you have around people, and it's probably more around just having a bad day, in terms of the staff all having a bad day at work, and just things become challenging in that respect, or it's those types of things feel overwhelming. But I think if you were to look back and reflect on those overwhelming times, you kind of look, I did take on too much, and I didn't have the right supports in place for me to be able to really succeed at that properly, or that type of thing. So challenges, I don't really consider really bad challenges or anything like that. It's kind of times of overwhelming, and everyone gets that. There's challenging times in managing a pharmacy. There's I've done that too. There's really challenging times in some things that where you think you're doing a good job, but you're not.
Or you think you're not.
Or you think you're not, and it is that kind of, when you feel overwhelmed, but then you kind of you've got, that hindsight it's that 2020 kind of thing where you kind of think, yeah, I know why I was overwhelmed, or I know why I found that a challenge. I kind of bit off more than I could chew, or I wasn't quite ready to take that on.
I know in one of our previous conversations, you mentioned a time when you were doing an externship in Australia.
Yeah.
Are you able to elaborate a little bit on that?
Yeah. So this is my in your P4 year. So this was your final year of pharmacy school, and back then we got the opportunity to be able to do that overseas. If the 2 weeks, your week in your community pharmacy and the week in the hospital. So I had family over in Melbourne, so I was able to toddle off to Melbourne to, organise getting a pharmacy over there and a hospital pharmacy over there. And at that stage in my vision for myself and my dreams in my career, I was going to go straight into hospital pharmacy. And I had a great kind of week within the community pharmacy, and I did really enjoy that. That was a lot different. And then when I went into work at the hospital pharmacy in Melbourne, I had a terrible time in terms of the supervising lead pharmacist there. I want to say mean, but he was. It was mean because, he'd random questions at you, kind of like, and you wouldn't have the answer to it, and you'd go, oh, they don't teach you that in New Zealand pharmacy school, do they? Or, it was kind of like not a pleasant environment for hospital. And that kind of changed my track of everything. I was just like, well, maybe I'm not destined to be into hospital pharmacy, and then was able to, and went into community pharmacy from that point of view. So it was a little bit disheartening as a young almost pharmacist going into internship, but it did kind of change my trajectory of where I was actually going to go, and I went with community instead. But then that served me really well as well. So there's things that I've done within community and travelled and probably many more positions available overseas for community back then. Well, you could jet off to London, or you could jet off on, I did Ireland instead. So and worked over there. So it
didn't stop you from going overseas and working in pharmacy.
No.
But would you say it's
that fire was always there for the clinical stuff, Sharina? It was, as in it was still kind of there, and because as came back from overseas and I had a family, and and there was that need to do something a little bit different once my children were old enough to have me studying at night, or they're a little bit more self-sufficient where they could make their own toast, or so and just that desire. And actually I work with her now as a pharmacist at the hospital, but she came from overseas and she'd been working in hospital and was really clinically minded, and she came and worked with us in the community pharmacy I was in, and just kind of really inspired me, and kind of reignited that kind of want to do a more clinical role again. So so it never left completely, it was just delayed.
And now you're working in clinical roles, both in in primary care and in hospital environments. So as you say, it was always there, and it's just the right time for you.
Yeah, and I think it's just that slow plod I've made through. It's been these little incremental steps all the way, where I don't think I've ever gone backwards, but just made these little small steps to where I am now with having this business and basically being responsible for my own time, and organizing my own time instead of working for yourself, really. Yeah.
Indeed. So with all the experiences that you've had and the environments that you've worked in, and the challenges that you've faced with working full time and doing your diploma and having a family and, you know, being part of these projects, etc., what would you say would be your biggest accomplishment to date?
Oh gosh. Career-wise, I think it's where I am now, like I just said before, in terms of I feel content with where I am in my knowledge, in my experience, and you're confident, you know, you're a little bit more confident than what you are when you're younger, in terms of, you know, there's not one accomplishment, because they've all been, you know, every little project that I've been part of, or, you know, pharmacy that I've worked for, they've all contributed something to make me feel accomplished now. Like, it's, I suppose is the way I explain it. There's not one thing that's, you know, my most favorite, and my, you know, it's not like saying my favorite country to visit is, you know, this country, you know. It is a series of things that kind of have been either through the people I've met or the experiences I've had. They've all kind of been little things, little incremental things that have kind of built up to make me feel accomplished now, you know, in terms of what I'm doing. I think is, so as an accomplishment it would be now, but because of everything else, those little things.
So the journey to get to where you are now.
Yeah, I think so. Yeah, because you can't, I don't think you can just pinpoint one particular thing. And, you know, there's parts when I've been really proud of myself in terms of, you know, the diploma, that second year diploma was a really, here we go, it is challenging, it was challenging for me. You know, you know, we were building a house and I was managing a pharmacy and doing my diploma all at the same time. And I actually don't know how I got through that year, but that accomplishment of doing that, I suppose, kind of set me up to know that it's a bit of resilience, I suppose, in terms of I am going to be able to accomplish what I want to achieve eventually, because all of these little incremental things that have kind of shaped where you're going.
You just mentioned the word resilience. What does resilience mean to you?
I think for me it is, you get through it, you face it till you make it, kind of thing, and then you kind of do reflect on it as to, there's always something you get out of a situation or something that you've experienced. So even if it's a complete failure, you still learn something from it. Like, in terms of, so that's how I see resilience. It's kind of like, I'm not going to see a failure as being something that I can't do that anymore, I'm not going to be able to do that. It's like, okay, so what part of that am I able to take out of it as a positive and go forward? I think that's resilience. I think that's not seeing negative things as completely negative and I'm going to give it all up and I can't do this anymore, and, you know, those types of things. And don't get me wrong, I've had those moments, like, absolutely, you do have those moments. It's like, this is, you know, I'm going to give it all up and I'm going to be a beekeeper, you know, kind of thing. But I think at the end of the day, I know I'm good with patients, and I love being a pharmacist. So that resilience is kind of like it comes from having those experiences and just kind of going, I can do this, and you are good at what you do, and just, I think, backing yourself. I think not perfect though, that's for sure.
Always have to strive for something, right?
Oh, God.
Can't be perfect.
No. No, but I suppose that's in a nutshell. I love being a pharmacist. I just enjoy being a pharmacist. I love, really interacting with patients, and I don't think I could do many other things.
You can hear that passion in your voice as well, and that motivation to continue doing what you're doing, which is amazing to hear.
Yeah, I do really enjoy my career.
And knowing that you enjoy your career, you've enjoyed the 20-something years that you've been in pharmacy overseas or in New Zealand and in different environments. If you could go back to when you first graduated from pharmacy school and give yourself one piece of advice, what would that be?
I think probably what we just talked about, the resilience in terms of knowing that it's all going to be okay. Everything will work out okay. You'll have, sometimes it doesn't feel like that, you're winning or you're going very far, or, but sometimes just being patient and sitting and being and knowing that every experience you have, it's kind of, it's giving you tools and setting you up for for future things. Everything has a purpose in it, in a way, kind of thing. You're meant to be on this particular project because that will allow you to meet other people that then will know, being you. I think as we get older and more experienced, we do reflect a little bit more than probably what we did as young. I think it's in terms of when we went through pharmacy school, we didn't really have to reflect on our practice too much. Like it wasn't ingrained in us. I think the young pharmacists coming out now, it's a really important part of their learning and their journey and their career, is being able to reflect. So I think to be able to tell my younger self, have those reflection moments a little bit sooner than what you ended up doing, 5 years afterwards. Probably not the ideal time, but it's those types of things. I think with young pharmacists now, have a really good ability to be able to look at how something went and learn from that, and that's something that I can do quite easily now, but maybe when I was younger I wasn't able to do as proficiently.
Thank you. We're just going to move on to the next section now, Megan, and I just want to ask you, what was the driver for you to start your own business and become self-employed / a contractor?
So it definitely was the, again, it's the COVID-19 thing and that kind of pushing. I always had these things in the back of my head around what I wanted to achieve, and that was through the geriatrics, kind of the polypharmacy, and working kind of in that space. And in those more clinical roles, to kind of one, fulfill what I think I could probably give and to people, to allow them to be more empowered about their medications and things like that. And I kind of just didn't think the environment that we had in Nelson wasn't conducive to that, in terms of we had no funding for facilitators. We had, so if I'm going to make it happen, I can't just have all these thoughts in my head about it. I've got to make it happen. And that COVID environment, in terms of it, was a bit chaotic at the time, coming out of the lockdown and where's the world going and things like that. It was like, well, there's no better time now than to do it now, kind of thing, and just and give it a go and have a shot at it. And if it doesn't work, well, so be it, kind of thing. I think that was the and it was, I just had all these kind of ideas in my head about what pharmacists could do with patient in that journey and that type of thing. So I just kind of had to give it a go. And as a contractor, I mean, you can just set up as self-employed and that's not a problem. But I kind of thought if I do it as a business right from the onset, set it up as a company, then I don't have to think about it again in 6 months' time when I think, well, maybe I should have done it as a business, or just, let's go the whole hog now and just go from there and just see how we go. If we're going to do it, go the whole hog. So, because I could have just left and just done locum work and just, things on the side. But I kind of went, okay, we need the ability to be able to do private MTAs, or, I need to be able to be a credible around that I've got a company name and rather than just being a self-employed contractor. Set it up properly so that you have a logo and and a bit of a character. You're branded basically, so that it looks a bit more credible.
Indeed. So you've now talked about your driver, your want for a change. You obviously recognised that there was a gap because there was a lack of funding in the region as well, and you wanted to plug that gap and say, I'm Megan Peters, this is my business, this is what I can do for you.
Yeah.
For anyone else who's thinking, oh, maybe I should think about becoming self-employed instead of being an employee, what skills or what do you think they would need to think about before making that change or that leap?
I think one of the things that you need to be able to do is be quite motivated and disciplined around some things, and be prepared to, in terms of the locuming space, that you are being relied on to, and provide the service. And so, you have to be quite disciplined around a few things, especially in getting your work, because you're only going to be able to eat what you kill. If you want to, I had a friend say that to me once and it's kind of stuck, so it is that kind of, you've got to be able to get yourself out there to be able to get the work, to be able to live, really. So and be disciplined around that and continue. Good advice, have good friends. I have some professional friends I was able to touch base with who are in business, an accountant, things like that, just to make sure that it is the right kind of thing to do and how could that be geared to do that. Just getting a bit of advice around it as well, rather than just taking the leap, well, it was a leap, but it was an informed leap. I think that's the key thing, is that just to be really disciplined about yourself. You've got to, you're in charge of your workload. You can't just, turn up on Monday. You have to go and find that Monday work. You have to go in, or that project that you're saying that you're going to be able to complete, or, that audit that you're going to be able to do. You've got to be reliable and deliver essentially on that as well. Or that patient that you're going to go and do that MTA for, is that you do deliver it timely to them, or their GP, or those types of things, and make it quite a disciplined thing, really.
You have to be disciplined, self-motivated. If you don't look for the work, proactively look for the opportunities, then you may not have any work. So
exactly,
and that's ongoing, right? It's not just I've got something for next week. If it's not an ongoing contract, well then what do you do next?
Yeah, or if your contract's for 3 months or whatever time that it is, that you've got something backed up to then follow on with it. Or even if it was a lot of the time I was doing some locum work, pharmacies needing locums at the moment, so it was in those early stages, it was really being able to get that locum work was putting your name out there and just saying I'm available. There's a lot of locum work available at the moment, but you do have to be relied upon, basically. you have to be reliable. And yeah, I mean, I could have more locum work if I wanted to, but there's only 7 days in a week.
Now, I'm just going to end on a personal question, Megan.
Oh, okay.
Hobbies. What
Ooh.
is your favourite hobby and why?
My favourite hobby. Well, I won't say reading journal articles because that's really boring. It's not really a hobby. No, I don't. Yeah, I mean, I used to be quite, I was big into CrossFit. I'd quite liked the CrossFit. A little bit less able to do it now as I'm older and a few other things happening. But my daughter is quite an artist, and she's just going into NCEA and doing art and things like that. So I've just kind of followed her in her footsteps a little bit, and I'm just trying a little bit of painting at the moment.
Oh, lovely.
So I'm just, and I'm enjoying it. Like, it's just something that's really completely different, and it's using a different part of my brain. So I am quite enjoying that. So I would say, yeah, just learning how to paint at the moment.
Right.
Yeah, that's probably the main thing. I've got a new puppy.
Oh.
So you know, getting him trained up and walked and things like that's quite, you know, that's taking up a lot of time at the moment. So
Gorgeous.
Yeah, and you know, in terms of other things, I mean, I'm not really big on gardening and things like that. So yeah, so the hobbies would probably be more around the painting and things like that at the moment.
Great. Bit of creative energy.
Yeah, absolutely.
Yeah. Excellent. Well, thank you so much for your time, Megan. It's been a fabulous conversation, and just finding out a bit more about, you know, what you've been doing in the last, you know, few years, and the changes that you've made and the experiences that you're having, and hopefully for you know, some people that are listening today, they might think, hey, maybe I want to make that type of leap the way Megan has as well. And who knows, there might be some people knocking on your door asking you a few questions in the next little while.
Thanks, Trudy. Yeah, no, it's been it's been great. Yeah, and I hope it does kind of bolster people off a little bit, that, you know, pharmacy is a good profession, and there are a great number of opportunities that are out there. So yeah,
Sometimes you just need to search for them a little bit.
Yeah, you do. Yeah.
Lovely. Thank you so much, Megan. Enjoy the rest of your day.
Thank you.